I want to introduce you to our next doctor. It's Dr. Bardia Anvar. And Dr. Anvar is the director and founder of the Valley Urgent Care in Northridge. And Dr. Anvar has actually treated Porter Ranch residents already. Over 100 patients he's treated in the urgent care. So please join me in welcoming Dr. Anvar.
Thank you very much. Just by a show of hands, how many people here have had any symptoms? Wow, so almost everybody here has had some sort of symptoms from the gas leak. We get a lot of questions as to why are these specific symptoms happening, and people have different symptoms. So the first symptom, I'm going to start from head to toe, is people are complaining that they're having hair falling out. We have one person. So really what happens is we don't know exactly what is in this gas, but the benzene definitely does destroy cells, especially cells that are quickly replicating, like cells in your hair, cells in your airways, cells in your nose, cells in your ears. So those, and cells in your intestines that are constantly turning over. So that is why you may see hair loss. A lot of people are complaining that they're having nosebleeds almost on a daily basis. Is it from the irritation within the gas, or is it from some other chemicals that, such as the benzene, that are causing this? So you do have the nosebleeds. It's most likely due to the fact that there's less oxygen in the air, because that oxygen is being deprived by the gas that is in the air, which is not oxygen. The membranes are getting dry, they're getting irritated, so you will get the nosebleeds, you'll get the respiratory problems, people are getting asthma. So when you do develop, if you do develop asthma, you need to be on inhalers for the asthma. So I'm just kind of going down the symptoms. And then the other thing is a lot of people can become allergic to the actual gas itself. So you can have an allergic reaction. Those people most likely will have rashes on their bodies. If you do develop a rash, it's most likely an allergy to something that's in the gas. I know there's sulfur within the gas, which I'm not exactly sure if it's added or as they were saying, they add something so you can detect the gas. But people who have sulfur allergies can actually develop rashes and have problems. Then you have the nausea and the dizziness, which for the dizziness, we actually treat it like vertigo. So we give vertigo medications for the dizziness. The nausea is most likely due from the gases itself. We have the headaches. A lot of people are complaining about the headaches, and some people are developing migraine headaches, so we will usually treat the actual migraine. This is also related to the gases. So one thing I just want to make clear is that initially when patients were coming in, we would just reassure them and tell them, oh, don't worry. And even now the health department has said that, oh, there shouldn't be any real health effects from these gases, maybe just an uncomfortable headache or something like that. We're seeing a lot more than that. So if you're having these symptoms and you think, oh, well, is it serious or is it not serious? Is it related to the gas or not? It probably is related to this. And the reason why I say that is two reasons. One, you could see by that graph that all the people who have symptoms are in what's called a cluster. And when you see a cluster of people having a certain kind of symptom, it's usually related to whatever is affecting them. So these clusters, which this whole room is almost a cluster because we're all from the same area, that's one way we know that it's related to this gas. The second thing, and more importantly, when people leave, most people when they leave, they feel better. Some people have long-term effects, they still have the asthma. It does take a few weeks. My number one recommendation is to leave the area. We even had somebody, he moved to Las Vegas, and he's having a good time staying at a hotel there, and the gas company's paying for it. But not to joke, but I really highly recommend getting out of the area. And now this is the other question I always get is, well, our clinic is in Northridge, so we get people from all over the place, and they say, well, I don't exactly live in Porter Ranch, but I'm having symptoms. And the unusual symptoms, definitely it's not normal to have a nosebleed every day. Well, some people say, I'm just tired. I feel, I just feel like I have the flu. If you're in you may have the flu, but if you've left your area and you feel better right away, it's most likely related to this, and you need to know that, and you need to make sure you get relocated. Other people have air purifiers and things like that, and I think if you have to stay in the area and you have to stay inside, that would probably be the best thing. People leave during the day because they live in Porter Ranch, then they come home at night and the effects come back. We're seeing a lot of that. The last thing I want to talk about, and I've been asked about this, well, is there a blood test? Is there a test that we could do? In our clinic, we are looking at different things we could do to identify if there's something we can test in people. The one thing that Dr. Texas spoke about, which I think is a good idea, is whomever your physician is to document what's going on with you. Make sure that they examine you. If you have children, that's very, very important. We don't know how this is going to affect children. And there could be, as I said, developing cells are the most affected, like your hair cells. Children are developing fast. Their brains are developing. Everything is developing. And I even know some children are still going to school in the area, which is, and I'm hearing that they go on the playground and they have a nosebleed and they come back inside the classroom and the nosebleed goes away. So very, very important to follow this, is to be seen by a doctor, have this documented. As we were saying, chest x-rays, lymph node examinations, having a complete examination, because God forbid, if something does happen, you want to have a baseline of where you are at, because you don't want to come 2 or 3 or 4 years later and say, well, something happened and you were never examined before, and we don't know, well, maybe that was normal, maybe it was abnormal for you, or what's going on. And I don't want to make anybody paranoid about this. So there's 2 forms of paranoia. One is to think, oh my God, what's going to happen to me? I don't want anyone to be worried about it. We haven't seen anything really serious, except for people who are obviously on the elderly, who are very sick, who are on oxygen, and they have a lack of oxygen. So I don't want anyone to be paranoid in that way. And I also don't want anyone to say, well, is this related to the gas leak or is it not? Do I just have a sore throat? Do I have the flu, or is it related to that? I would recommend being seen by a physician to make sure that what is it, and we can track that as physicians. Our clinic is not in Porter Ranch, and I know a lot of people have been relocated. We are in Northridge. We'd be happy to see anyone. If anyone has any questions, we did distribute some flyers about our clinic. And we are training all of our staff specifically about this so that we could see this. But this is actually a very serious health concern. And I am seeing a lot of patients in our clinic that have serious problems, but I'm also seeing out there that they're telling people, well, don't worry about it. It's just it's just an irritant, and it's just what we've added to the gas. And I don't want anyone to downplay their symptoms either. Take it seriously and be seen. Hopefully it's nothing. So thank you very much.